All right. So, welcome everyone to the opening night of the Tri-State Eating Disorder Conference. And I wanted to just take a second to let everybody know that I'm kind of in the eye of the storm. I know sometimes Dick has lectures that are entitled The Eye of the Storm. I'm in Evansville, Indiana. So we have a backup here. Marcella's going to hop on if by chance my power goes out. So I just want to let you all know that Marcella is in the background. And so my name is Theresa Chesnut, and I'm a clinical social worker, and I've been treating eating disorders um, for about 25 years and trained in IFS about 20-ish years ago with Dick Schwartz. And I won't do a lot of history about the Tri-State Eating Disorder Conference, except to say that when I moved to Evansville, Indiana, about 4 years ago, wanted to bring resources to this area. So the last 2 years, the conference was in person. Last year, the whole entire conference was on eating disorders and IFS, and we had the amazing pleasure of having Dick Schwartz do a half-day training there. So grateful for that. And so he was able to join us tonight to just kick off the conference. The focus this year is on eating disorders, weight stigma, and IFS. So I will be giving a little bit more information about myself and the conference tomorrow, but I really wanted to leave enough time for Dick to be able to talk and people to be able to ask Q&A. So the format for the night will be that I'm going to introduce the moderator, who's Brittany. And if you have questions as Dick is talking that you want to put in the chat, she'll be gathering those questions. And then about halfway through, Dick will do a guided meditation, and then we'll open it up for Q&A. So with that, I want to introduce Brittany Greer, who's with Haven of Hope. Haven of Hope is our platinum sponsor this year, our exclusive sponsor. So I really, really appreciate Brittany being here to help moderate. She is the clinical director at Haven of Hope. And I'm going to let her go ahead and play her video, and then I will do her formal introduction.
The experience of getting to see people come in a certain state and see them transform and grow, I have a lot of gratitude for getting to experience that and walk along clients on that journey. Haven of Hope is different than other treatment centers because of our really strong focus on trauma. We really pride ourselves in making sure that every staff member is trained thoroughly, and we go past the eating disorder. We really want to understand where the pain is, where the wounds are, and try to heal them. Here, clients are going to experience a holistic approach to therapy. We primarily use the internal family systems model, and the approach that this model allows us to take when treating our clients, specifically the eating disorders and trauma, is significantly different. Just this approach offers a way for clients to know that they can internally transform the roles that these disorders have taken in their system and truly see a change happen on the outside after that internal transformation happens. And that's something that does not require anything in their external life to change. So it's unique in that way. Activities patients can enjoy here in their stay would include equine therapy, support animals, support dogs come into the facility and be with the clients. Other activities would include art therapy. We do a lot of art while we're here. And then fun things like puzzles and maybe a show on Netflix if it's appropriate.
The clients have cooking skills with the chefs where they learn different ways of preparing foods, but the chefs prepare all the meals.
Food that's cooked with a lot of love. We take our time, like I said, to make sure each individual gets what they need, and we try to make sure we take step by step to just make sure that prepping their food and giving them exactly what they need so they can get the treatment and help that they need.
For me, seeing a client progress through their recovery is just one of the most rewarding reasons for working here. The difference in their personalities when they first get here to when they become nourished, it's just a beautiful transition.
One of the biggest thing we see is the restoration of hope. We see people come here that they may not have a lot of reasons to have hope at the point that they enter here, and through the internal work that they get to do here that does not rely on their external circumstances changing in order for them to experience some real healing, we get to see them leave here with a greater sense of hope that is far beyond what they were carrying when they walked in.
Haven of Hope is a wonderful place for clients struggling with an eating disorder to come to feel great in a home environment with plenty of support to help them get through their recovery.
Haven of Hope is a fresh start. It's definitely a light at the end of the tunnel.
So again, just want to thank Haven of Hope for your sponsorship. And Brittany, just want to take a second to introduce you. You're the founder and executive director at Haven of Hope Eating Disorder Care Center, which is a residential treatment center that specializes in treating eating disorders and trauma through internal family systems model. And Brittany is an eating disorder and trauma specialist and trained in IFS, and has trained the team at Haven of Hope to bring a holistic parts approach to healing the clients they serve. So thank you, Brittany, and I'll turn it over to you.
Yeah, thank you so much, Theresa. I know I've told you this already, but I'm grateful and honored for the opportunity that we get to partner with you in this way and to get to moderate tonight. This is really special, obviously, for a lot of reasons, personally and professionally. So I'm very thankful to be here tonight and get to experience this with you guys. Okay, so I'll get started. I get to introduce our speaker tonight. And so the talk for tonight is our opening talk, right, which is integrating internal family systems in the treatment of eating disorders. And tonight we'll be featuring Richard Schwartz, who goes by Dick as the preferred name. So you'll hear me refer to him in that way in his bio. So Dick began his career as a family therapist and an academic at the University of Illinois at Chicago. There is where he discovered that family therapy alone did not achieve full symptom relief. And in asking patients why, he learned that they were plagued with what they called parts. These patients became his teachers as they described how their parts formed networks of interrelationships that resembled the families he'd been working with. He also found that as they focused on and thereby separated from these parts, their parts, they would then shift into a state characterized by qualities like curiosity, calm, confidence, and compassion. He called that inner essence the self and was amazed to find it even in severely diagnosed and traumatized patients. From these explorations, the internal family systems model was born in the early 80s. IFS is now evidence-based and has become a widely used form of psychotherapy, particularly with trauma. It provides a non-pathologizing, optimistic, and empowering perspective and a practical and effective set of techniques for working with individuals, couples, families, and more. More recently, the corporations and classrooms. Dick lives with his wife, Jean, near Chicago, close to his 3 daughters and his growing number of grandchildren. So welcome.
Thank you, Brittany. It's really good to know about Haven of Hope, and I'm honored that you've embraced IFS so much there. And always great to be with you, Theresa. You do have a long history. I guess it was 20 years ago. And yeah, I'm honored to kick off the conference, and I have to say I love talking about eating disorders, partly because I feel a great debt of gratitude to eating disorder patients who, what Brittany didn't mention was the patients that I learned it from were part of an outcome study I was doing at the time, and had bulimia, and some of them were incredibly articulate about their parts and all the relationships they had, which initially scared me, but as I got over that, I felt so lucky to have these clients that could kind of co-lead experiments inside and taught it to me. And so that got me going on the whole IFS model. And then there was that time, I guess 20 years ago, when Castlewood, where I met you, adopted IFS in a big way too. And so I came down to St. Louis and immersed myself in that world again. And then ultimately, I would kind of come into the eating disorder world and then leave and then get pulled back in again, and met my wife because of eating disorders too. So yeah, I'm very grateful just for the field and for now the degree to which IFS is embraced in the field. And so I'm really happy to be with you.
Thank you so much, Dick. Yeah, I was just thinking back about kind of the timeline of my own evolution with IFS and eating disorders that I'll talk about some tomorrow on the panel that I'm on. But I'm wondering if you could just do kind of an overview of IFS and anything that might have changed in your perspective about eating disorder clients compared to people who don't have eating disorders, as you've learned more and more about the model as it's gotten, as it's kind of evolved over the years.
Yeah, so to do it, I go back to that outcome study. So as Brittany mentioned, I trained as a family therapist, and as such, didn't study intrapsychic process at all. I was part of that polarization between family therapy and psychoanalysis. So, and I was one of those obnoxious family therapists that thought we'd found the Holy Grail and we could cure anything. And I was in this department of psychiatry, as she mentioned, and my hero, Salvador Minuchin, had claimed to have great luck with anorexia. So I wanted to prove it worked with bulimia. And colleague Mary Jo Barrett and I gathered together 30 bulimic kids and their families and did straight structural family therapy and found that it didn't work. A lot of my kids didn't realize they'd been cured and they kept binging and purging. And out of frustration, I began asking why, and they started talking this language of parts. And long story short, as I explored that and realized that I had them too, I just got curious. I stopped trying to force clients to stand up to their critics or control their binges. And I just started getting curious about asking clients to ask their parts why they did what they did. And all of them, every part had a history. And as I listened to that history, I learned that they were just trying to protect the client, although some of them were just stuck in the past. But that was very, very eye-opening. And what I would hear from these kids was that when something bad happened in their lives, it would trigger this critic who could be quite brutal. And that criticism would go right to the heart of another part of them that felt worthless and empty anyway, and now felt even worse. And that feeling was so intolerable to their system that to the rescue would come the binge. It would take them out, get them distracted from, or even higher in a sense, than all the pain of that worthless part, and the sense of emptiness that worthless part carried. And so there would be relief, but then the critic would attack them for the binge. And that again would go right to the heart of the worthless part. And so there was even more need for the binge. And they were caught in that vicious cycle, sometimes for days. And that was intriguing to me because it sounded similar to what I was studying in families, which were these circular sequences of interaction. And so I had also a big advantage. Not only had I not studied a psychic process, so I had to really listen carefully and believe what my clients were teaching me rather than overlay some theory. But I also had a background in systems thinking that allowed me to focus on how it operated as a system rather than on each individual part. And so as I did that, I began to try and create a map of this inner world. And what became clear right away was that there were parts that, before they'd been hurt, would be these terrific inner children who lend us all kinds of wonderful qualities like playfulness and creativity and openness and love, and but they're the most sensitive parts of us. So when we do get hurt or shamed or terrified, they take in those burdens of emotional pain or worthlessness or terror, and now they have the power to overwhelm us and pull us into places we don't want to go. And so we have almost a natural impulse to lock them away inside in inner basements or abysses. And so for these, what we come to call exiles, it's insult to injury. The injury was the trauma, and the insult is now we abandon them and try to stay as far away as possible. And once you have a lot of exiles, you feel more delicate, the world seems more dangerous. So a bunch of other parts are forced out of their naturally valuable states to manage your life so that your exiles stay contained and don't get triggered. And so we all have a bunch of what I call manager parts, manager protectors. And common roles include, and this particularly from eating disorders, a part that keeps you a certain distance from people so no one hurts you again in that same way, or a part that makes you look perfect and worries all the time about how you come across so that you please everybody, and or a part that strives to achieve a lot to counter the worthlessness, or a part that takes care of everybody else and doesn't let you take care of yourself. So everybody depends on you. And so, yeah, those are common in eating disorders as well as a lot of other problems, and would tend to try to dominate the client and run their life. But the world would have a way of triggering your exiles anyway, which would release this raw flames of emotion from your gut that could take you out. And so there was another set of parts that I learned were just kind of on duty, waiting for such an emergency, that would go into impulsive action to get you higher than those flames, or douse them with a substance, or distract you till they burn themselves out. So in eating disorders, that often is the binge, the part that immediately, if you feel any kind of upset, will go to food and try to stuff it that way. And then the act of the binge brings more criticism. So you have this big battle going on between these managers who are desperately trying to get you to not binge, and then the binging part is just trying to take care of the young ones who've been so hurt. And so that's sort of the traditional model that applies to a lot of other addictions and other things that we work with, but certainly applies to a lot of eating disorders.
You know, Dick, one of the things that I was thinking about as I was listening to you talk is at probably the first year of the pandemic, the calls that I got, I know it's similar with a lot of my colleagues, for adolescents, well, not only adolescents, but people that didn't have eating disorder symptoms, all of a sudden were showing really severe signs of restricting. And I happen to get a lot of calls for adolescents with eating disorder, or that were athletes, that when the pandemic hit, all of a sudden things shifted, and several months into the pandemic, there are these full-blown eating disorders. And I'm curious if you could kind of speak to that from a parts perspective of a life event that would activate symptoms in that way.
Yeah, any event that triggers this intense anxiety or insecurity, or takes you out of your life, which you had designed to distract you from all those exiles. And now you can't. Now they're just kind of coming up and telling you how worthless you are, or making you feel that way anyway. Any event like that is going to make it harder to not have some kind of symptom. And for people inclined to eating stuff, that would be uh, just a natural consequence of something like that. And the other concept that wasn't so prominent back 20 years ago for me, but has become more and more, is the concept of what we call legacy burden. So I haven't introduced the idea of burdens yet, but what I found as I explored all this was that parts are forced into these extreme roles out of their naturally valuable states, because I believe we're born with these parts and they're all valuable. They have these wonderful qualities and resources, but they're forced into roles, just like kids in a family. If you work with a dysfunctional family, you'll find that there are kids in stereotypic roles. Like the addictions world talks about all these different roles for kids, and they're not who the kids are. They're just in these roles to protect themselves or protect the family. And once you fix the family, they're released from those roles. Well, the same is true with this inner system. And so as I explored what kept these parts in these roles, they would talk about these extreme beliefs or emotions that they carried that came into them from the trauma, from the bad parenting or whatever had happened, and then attach to them like a virus and drive the way they operate. So that burdens and unburdening is a big part of IFS, and also that they were frozen in time during the trauma, such that they still think you're quite young and they have to protect you in the way they did back then. So as I got that, I got very curious about how do we unload these burdens, and now we have whole protocol for doing that. And amazingly, once parts do submit to unburdening, they will immediately transform into their naturally valuable states, almost like magic, like curse has been lifted. And then there were some burdens that clearly didn't come from the client's life, but actually they would see scenes from what were clearly relatives, ancestors, and so on. And so these we call legacy burdens. And then there are legacy burdens that aren't necessarily coming from your lineage, but just exist in our culture. And so I became more and more focused on the impact of those legacy burdens on parts, and then creating these polarizations that then wind up leading to the exiling of a lot of parts too. So, and that happens in the families. The families carry these big cultural legacy burdens as well. So a lot of the work is not only with the little triangle that I described earlier, the critic, the binging part, and the exiles. We're still doing that, but we're focusing also on unburdening these legacy burdens like anti-fat bias, as you know, and it's just in our culture that's related to white supremacy, and as Jean wrote in her book. And with that comes a kind of hyper focus on perfect appearance and perfectionism in general. Again, cultural legacy burdens and patriarchy and caretaking as related to patriarchy and ignoring your own needs. And then this idea that if you have a problem, it's because you lack willpower. So all of those tie into eating disorders, and a lot of those are picked up by our managers, and then they'll drive the managers to be extreme, and then these other parts will polarize and get extreme in balancing, trying to balance the system. And then you're in this kind of battle that exiles a lot of parts. So I just wanted to mention how much you asked about what shifted, and I think that focus on legacy unburdening is something that we do more about now.
And can you talk a little bit more about like the diet culture that we've all kind of grown up in, and how our I think that a lot of times it's really, really difficult to disentangle from what we've been exposed to growing up and in culture today. And like what you're saying, parents having to be a certain way, body having to be a certain way. Um, and then as therapists, how do we work with our own parts and our own biases around food and weight, to help clients heal their relationship with food and body? I'm wondering if you can talk a little bit about that.
Yeah, I mean, if you grow up in this country, you have that legacy burden more for women, but I've been aware of it too. And that your value is so related to your appearance, and even more so to a thin appearance. And that because therapists are steeped in that as well, it's really crucial that they are able to unburden that, because even unconsciously, if you haven't done your work around it, you're going to give that message somehow to your clients, and or you're not going to take as strong a stand as they need. And uh, yeah, and that particular legacy burden then pushes the dieting managers, the managers that are desperate to make you look the way you're supposed to in this culture, to try and dominate. And in any time, in any inner system or outer system, one set of parts dominates the system, then there's going to be a lot of pushback and a lot of other parts getting extreme in the opposite way. And so that, I think, is the onset of a lot of eating disorders, and the kind of diagnosis that you get, whether it's anorexia or bulimia or all the others, is related to which set of parts totally dominates, or is there a kind of battle between them going on all the time, where neither side is dominating, but they're each taking over separately. And so I'm not sure I answered your question, but that's what's coming to me.
Yeah, that's great. And I think I was also just thinking then of the polarization, and um, how a lot of times the belief around recovery from an eating disorder is around symptom containment
Mm-hmm.
and getting the binging to stop, or getting the person to a safe weight, um, getting them to stop binging and purging, and just putting a lid on the symptom.
Yeah,
And how, and a lot, in some cases, that's really important
yeah,
because eating disorders are life threatening. So figuring out how to get some stability there medically, and to know that putting kind of a lid on this part, it's going to show up somewhere else.
yeah. I totally agree, and I'm really happy to hear about Wisdom of Hope, because I can't tell you how many eating disorder therapists I've supervised who are reluctant to refer their clients to inpatient or to treatment centers because of what you're talking about. And in the process, they've been working to try and get the client to honor the eating disorder, and and everywhere else they get the opposite message. And so what I've tried to work out is that to prepare the client going into the hospital, that that place isn't going to give the same message to your part, but you can still do that while
Yeah.
you're there. And it is important that you get healthier and gain more weight, because while your body isn't allowing us to do a lot of work right now because of what's happening with it. So yeah, so I agree with you.
And, um, I was thinking again about just different modalities, and how um, learning like about family-based therapy, which is the kind of the gold standard, the gold standard to treat adolescents and families when there's anorexia and bulimia. And I'm trained in family-based therapy, and I absolutely think that there is some important aspects of using FBT with helping kids recover. And though what I've found most valuable about IFS is really being able to help the parents work with their really scared, terrified parts
Mhm.
and their own managerial parts and their people pleasing parts and all the different parts that are coming into the room when they're needing to kind of step up to help their child recover. And so being able to access the IFS model in my own self energy and help the parents access their self energy, I've really seen as being really transformative in working with adolescents. Um, and so for some of the people that might not be as familiar with
Mhm.
IFS, can you talk a little bit about um, let's see, like what the process looks like
Yeah.
in a session, maybe?
Yeah. Before I do that, we haven't really mentioned self yet. So,
Right.
as I was getting hip to the fact that these parts weren't what they seemed and they deserved to be listened to rather than fought with, uh, I, as a family therapist, tried to impose family therapy on this inner system, and I would try to have my client uh, talk to the critic, for example, rather than and ask questions of it rather than fight with it or ignore it. And as I'm doing that, uh, sometimes suddenly my client would be hating the critic again. And it reminded me of family sessions where I'm trying to have two family members work things out between each other, polarized. And a third family member jumps in siding with one against the other. And we, as family therapists, were taught to get that third member to just step out and to cut it out. And they would then settle down, the other two, and have a decent conversation. So I began asking clients, could you find the part that hates the critic or is terrified of the critic or whatever extreme feeling they had? And could you just ask it to step back and stay out of this for a while? And to my amazement, clients could do that. And when they did it, they would shift. It was like this other person emerged suddenly out of nowhere, who not only wasn't afraid or angry at the critic, but now had a kind of calm relative to it or confidence and even compassion for it out of the blue. I didn't have to pump up their muscle of compassion.
Yeah.
It's just there. And in that state, the critic would react very well and would share its secret history of how it was forced into this role that it hates and how it would love to not have to do this, but it doesn't trust it's safe to not do it. And then we would learn what it protected and we could heal that and liberate that critic. And when I would do the same process of just getting these other parts, these polarized parts to open space inside, it's like the same person would pop out in different clients with those same C word qualities of calm, curiosity, pure curiosity, compassion, confidence, and then four other C words: clarity, courage, creativity, and connectedness. So we call those the 8 C's that characterize what I'm calling self. And years, 40 some years later, we can safely say that that self is in everybody, can't be damaged, knows how to heal, and is just beneath the surface of these parts, such that when they open space, it pops out. And that's the big deal about IFS. And that's so counter to the way people with eating disorders are seen, because they're seen pathologically. And this is saying uh, there is this incredibly healthy core to them and can be accessed actually quite easily a lot of the time. And in that state, they begin to heal themselves. So, yeah, so that's self. And so, in terms of working with somebody, uh, I might have you start. I often do start with having people focus on the critic and find it in their body, and often it's in their head, but not always, or outside their head. And then as you notice it, how do you, Theresa, feel toward it? And in answering that question, you're telling me how much of that self is present versus other parts that are polarized with it or scared of it or have some other attitude about it. And so you'd say, I don't like it. It drives me crazy. It's on my back all the time. I'd say, I get why you don't like it. I get that it has had a bad impact, but right now we just want to get to know it. So let's see if the ones who have that attitude could give us the space to just get to know it for a few minutes. We're not going to give it more power that way. We're just going to help, maybe even help it not have to do this. So I'm giving some incentive to these other parts to cooperate. Much of the time they will. And then I'll come back and I'll say, now, Theresa, how do you feel toward this critic? And it'll be an entirely different answer. And you might say, I'm just curious about why it calls me names all day. Okay, so why don't you ask it? And then, so direct your question to that place in your body and focus there until you get the answer from that place in your body. And don't think of the answer, just wait and see what comes. And ask what it wants you to know. And people ultimately, through asking that question and another question, which is ask it what it's afraid would happen if it didn't do this all day, start to learn that it does have a positive intention of protecting. It's either protecting you by trying to make you look perfect or trying to make you achieve a lot, or it's trying to run down your confidence so you don't take any risks and get hurt. But almost always they're trying some way to get you to behave, and they're desperately trying to keep you safe. And so once you can appreciate that, and you can extend that appreciation to the part, often they'll soften a lot. So they just have always been hated, and suddenly somebody's appreciating them. And then they'll let us know about what they protect. And then we'll negotiate permission to go to that. And there's like I said, a protocol for healing these parts that are frozen in time and getting them out of where they're stuck in the past and witnessing what happened in the past. And when they feel fully witnessed and they're what we call retrieved from where they're stuck, they're willing to unburden, to give up these extreme beliefs and emotions. And when they do that, they transform. And then we can bring in the critic to see it doesn't have to protect this one anymore. What would it like to do instead? And maybe it would like to unburden, and so on. And then we go to the next one. We go to the binge part, honor it as a hero, as we learn about how it was desperately trying to protect, and so on.
Yeah, I was just thinking about when I first saw you lecture in St. Louis, and I consider myself symptom free, recovered from an eating disorder, completely symptom free, and went to hear you lecture. And it was the first time that I had ever heard anybody, not only when I was recovering from my own eating disorder, but anybody that I'd seen lecture or read about that really approached people who had eating disorders from this very compassionate, curious, non-pathologizing way. And so for me, I was like, oh my gosh. And it just is like, there is more to recovery than just being driven by these symptoms. And so then that led to really wanting to learn the model and begin to really understand not only my own parts, but my clients' parts. And there was, I was thinking about when that first year that I learned the model and was just kind of practicing it, that there would be a couple different times that stand out for me, that I would be really able to access self and be with clients as they were working. But every once in a while, a client would give me feedback and say, it seems like there were two. One was like, it seems like you're really mad at me right now. And I'm like, no, wait. And in the past, I would have been like, no, I'm not mad at you. But with the model,
Yeah.
it was like, wait, hold on. I literally was able to check in and be like, oh, wait, I know what's going on. I know I am really worried about your suicidal part. And I know that when I get really worried, I have this cold kind of part that comes in that gets very like, okay, what are we going to do? What's the safety contract and blah, 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 blah.
Mhm.
And then really ask the client to give me feedback. I want to know if you notice that I'm not with you. And similarly, so that really taught me too, to how to not only just be in self with the clients, but in outside of the office too. So I wasn't as driven by my managerial parts that were there to do a job.
Right.
So I was just thinking about that aspect of really loving that
Mhm.
component of the model,
Mhm.
where it allows the client to really be able to give me feedback when I'm off.
Yeah, that's a beautiful story, Teresa, because clients have incredibly sensitive parts detectors, and those parts detectors are scanning you all the time. And
Yeah.
if you do seem off to them, their parts will make up some big story about it, like you hate them and so on. And if you then say, no, I'm not mad at you, then you lose that test. I mean, you fail because now they're not going to trust you the rest of the, because they know something was going on. But if you do instead what you just did, you gain trust and apologize. And I will say to them, I'm going to work with this part so it doesn't keep showing up as this coldness when I get scared by your suicide. And I'm going to work with the parts that are scared by your suicidal part because I know it's just trying to keep you safe too. And that again, that's another difference with IFS. So worked in my career with hundreds of suicidal parts and never lost anybody because we go to them again with curiosity. Why do you want to kill her? Two answers, common answers to that. Either I can't stand how much pain she feels and I can't let her continue in this pain. Or she's done these bad things in the past, she's going to do them again. I want to protect people from her. Either of those will say, okay, if we could go to the parts that are involved, so the parts that carry all the pain, or the parts that have done the things that you don't like, and heal or change them, would you have to kill her? No, but I don't think you can do that. Okay, would you give me a chance to prove that we can? Because we can. So it's a totally different approach to suicide too.
Yeah. Yeah.
But that, yeah, the point you're making of how transparent as a therapist you can be and how once you say, yeah, it is this manager of mine that can be cold, all the stories about why you hate them go away and you can reconnect.
Yeah. Yeah. Um, so I'm just wondering if there are other aspects of the model that maybe we can talk a little bit about to kind of carry that theme of uh, therapist parts and all of the P's that are associated with presence and playfulness and how that kind of unfolded for you to realize kind of that part of the model.
Yeah. So again, we're just emphasizing the importance as best you can of being in self with your clients. And, many therapists come to eating disorders because they have an eating disorder. And so as you work with clients and you see parts of them that resemble parts of you, it's inevitable that the ones who don't like those parts or are afraid of those parts are going to come up in you. And so, it's just reiterating the importance that therapists do their own work because if you're afraid of or hate parts of you, you're going to leak that out to your client and you're going to, when they start to get, if you're afraid of your own exiles, when they start to get really rawly emotional, then you're going to ground them suddenly, or you just can't handle your threshold for
Mhm.
accepting that kind of emotion is going to shrink. And so, but if you can stay in self is a kind of magnet, or self is contagious. It pulls for the self of your client. and the energy of yourself is reassuring to your client's protectors, so that they sense the safety and they relax more and more, which allows their self to emerge more and more. And so when you have that kind of self-to-self resonance with patient, the level of trust is so high that they're willing to go to these very scary places that they've avoided their whole lives, which are where the exiles are. And yeah.
Yeah, and then one of the things that I was thinking again as you're talking is how to help the clients unblend with parts in between sessions, or like when I worked at a higher level of care, where like in group or even in individual work, might really be able to access self energy or work with parts, but as soon as they sit down to the table, they get really blended with a part, and everything kind of goes out the window for a little bit. And so I'm wondering if you could just explain what being blended with a part looks like, and how to work with a client to unblend with that eating disorder part.
Yeah, so especially when eating disorder clients face food, then the parts that have traditionally been the ones who kind of take over in the face of food and eating will immediately come to the surface. And what we mean by blend is yourself is always there, but these parts come in and merge their energy with self and obscure self. And it seems like they've taken over, like they're just the ones that are there. So the anorexic part is fooling with the silverware and, you know, and, you know, futzing around, trying to delay. And then the binging part is just gobbling. And so when you see those parts as a therapist, then you just say, okay, I can see to the client, you can say, okay, I see you're blended with one of those parts. And remember, we're working on not having it do the leading when you're eating. So let me just maybe ask this anorexic part if it'd be willing, just as an experiment, to unblend, to separate, and let you eat. And if it's not willing, that's fine. We'll talk to it later. We'll work with it about it. But if you can be in self and you're not doing it from one of your managers, then often in the moment, you'll get some unblending. And it's very palpable for people. They sense this shift in energy. And then they have more confidence that they can eat, and you don't have to, you know, lecture them about it. And so I think that's what you're asking about. Is that right?
Yeah, exactly. Yeah, yeah. So I'm wondering if this might be a good time to transition into doing a meditation.
Sure. Happy to.
I feel all right?
Yeah, yeah. So again, as people are listening, I'm assuming they're thinking about their own parts, and particularly how they relate to food in their bodies. And so I was going to offer a meditation where you could get to know one of your protectors. And, you know, we offer it to get to know a protector because that's safer than going to an exile. So, but maybe a protector that ordinarily you have an attitude about. Maybe it could be your critic, could be a binging part, it could be whatever the eating disorder part is. Uh, and again, if you don't feel up for this, please don't do it. But if you are up for it, then the steps are to just take a second and focus on how that part manifests in your mind or your body. So if it's a thought pattern, focus on that, or an emotion or sensation or impulse. However you experience the protector, Just focus on that exclusively for a second. And then notice where it seems to be located in your body or around your body. Many people can immediately identify where it seems to be broadcasting from or living. But if you can't, that's okay. You can still do the exercise. But if you can, then that becomes the place to which you address your questions and listen for the answers. And then the first question for you is, how do you feel toward this part of you that does this thing? How do you feel toward it? And if you don't like it, or you're afraid of it, or you depend on it, you feel a lot of, you rely on it a huge amount. Or so if you have any sort of extreme emotion toward it, that's coming from another part. And so we're going to ask that part to give us a little space just for a few minutes to just pull its energy back, relax back inside, and allow you to open your mind toward this target part. And if you don't sense that shift where the second part unblends, then just stay with that part that won't step back and get to know it and why it's reluctant to step back. But if you did sense that shift and you do have an open mind toward the original one, then go ahead and ask this sort of non-threatening, open-ended question. What does it want you to know? Or what does it want you to know about what it does in there? And wait for the answer. Don't think. Just wait and see what comes. And then a good follow-up question to that one is, ask this part what it's afraid would happen if it didn't do its job inside of you. And wait for the answer. Don't think. If you got an answer to that question, then you probably learned about what it's trying to protect in there, protect you from. And if that's true, then go ahead and extend some appreciation to it for trying to protect you, even if it's backfiring or it's screwing up your life. Let it know you get that its intention is protective, that it's not evil or bad, and see how it reacts to that appreciation. And a related question for it, if you could go to what it protects and heal or change that, so it was freed up from this role, what might it like to do instead inside of you? I'll repeat that. If you could go to what it protects and heal or change that, so this part was liberated from this protective role, what might it like to do instead? And then another kind of odd question for it is, ask it how old it thinks you are. Not how old is it, but how old does it think you are? Again, don't think, just wait for the answer. If it got your age wrong, then go ahead and update it and see how it reacts to learning that you're not as young as it thought and that you can handle more than it thought. Then a final question. Ask it if it carries somebody else's energy or if it carries energy that doesn't belong to your system, came from the outside. If it answered affirmatively to that, then that's the legacy burden. And let it know that you'll work to unload that at some point. And when the time feels right, thank the part for whatever it shared with you. And let it know this won't be your last time checking in with it, that this is the beginning of a new relationship with it. And then thank other parts for letting you do this much and come on back outside, taking deep breaths if that helps.
So as everybody is coming back and maybe getting reacclimated to being back on screen, I just want to encourage people if they have any questions or anything that they want to put in the chat for us to start talking about in a few minutes, we can do that. But as I let myself kind of go in, Dick, and do that exercise with you, and um, it it took me to a part that that I'm like, I've already dealt with that part. And so it reminded me again of clients that when I'm with them and they're like, I have gone to this like 10-year-old kid like so many times. And so I thought that maybe you could talk about the idea of the garlic clove. So it reminded me of like, yeah, I have done a lot of work around that. And there's still some burdens around that.
But first, let me see if I can get you to say more about your part. And like, I know you love this, that you're not wild about talking about this stuff, but I think it might help the group if you could.
Um, yeah, sure. Yeah, I just wasn't, yeah, expecting that. Um, so I just really focused, I was supposed to do this Instagram live thing right before this, right? And it was an epic fail. And so I have a critical part that was like, you should have practiced it. Probably there were a couple other people that said, why don't you practice earlier? And I'm like, how hard can it be? You click a button, like you talk. And so the critical part was like, I'm pretty upset about that failure. And so I tried to just really focus on that. And as soon as I was able to unblend with that, for me, when I feel really grounded and in self, I feel kind of energetic feeling
Mhm,
kind of
mhm,
come up, kind of a tingly feeling.
yeah,
And so then I knew I was kind of
mhm,
there and just stayed with it and just stayed curious about how far back it goes and
mhm,
back to kind of a middle school scene
mhm,
um, that has that kind of was a time that really kicked into high gear, a more over functioning part.
mhm,
And I had this scene where I don't know if I was like kind of frozen there, but this scene of being in the nurse's office and my mom being there and the principal being there and hearing them talk about me burning the candle on both ends and the blah 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 blah, and I'm like, yeah, all right, so it's still there a little bit. So that protector really was kind of that part that that part of me that is really good at doing a lot of different things.
mhm,
That's when it got kicked into an extreme protector.
mhm. Yeah. And so you have been to that scene a number of times. Is that what you're saying?
Yeah.
And you've gotten that girl out of there, and you've done all the protocol.
Yes. Yes, and there must be something more about this specific protector though,
Yeah,
the one that kind of can take on a
yeah,
lot.
yeah,
And
yeah.
so that's my curiosity is like, yeah, there's been a lot of healing around maybe some of the burdens, but one of the protectors that got kicked into high gear during that traumatic time in my life was this part that can function and overfunction really well.
Yeah. So that's what we find, that if you do have to go back and back, and or if a part on burdens and the burdens come back, and there's always a reason. And
Yeah.
there are 4 or 5 common reasons that I've written about, but once you figure out, and you can figure it out by just asking, they'll tell you, um, and you fix that, then it does stick. So
Can you can you mention what those are? The different reasons why burdens would come back?
if I can remember, so I'd say the most common one is that little, did you say 10-year-old?
No, this one was I
Oh,
was this
middle
one,
school, yeah,
yeah, 13, probably 13,
13,
14.
okay, yeah. Either she didn't feel fully witnessed, there's more to the story that she wants you to get, which is one. Or I think you mentioned that there are other parts that were protecting her that haven't been addressed yet, and that they haven't been updated about her. She doesn't need it now. Or or sometimes something happens in the outside world that scares the system. And so then they throw her back. And sometimes having her stay in that place and have all those emotions is being used by other parts to protect you, like to scare you into behaving, and they're not ready for you to let her out. So, but it's always one of those or a couple others.
Yeah.
But thanks for sharing it all. I know it's not your most comfortable thing.
Yeah, no, it's all right. And more clinically, I was also thinking about those ones that you throw in, about how again, I'm seeing a trend. I don't know if it's a trend or not, of more and more calls coming in of women that are perimenopausal or going into menopause that have recovered from their eating disorder, and now almost kind of like during adolescence, feeling out of control of their body, gaining weight, and a resurgence of eating disorder symptoms and self-doubt and all of those aspects of their eating disorder that had been gone for a long time. And so I was just curious about, like, that would be an environmental piece, I guess. Well, I don't know.
Yeah, I think I have read that that's the fastest growing population of people with eating disorders.
Yeah.
And it makes sense, especially with the weight gain, and that would bring up all those legacy burdens again about your body, and then trigger the parts that see your worth based on how thin you are, and
Yeah.
all that would go back into high gear. And then, as we keep saying, then those parts, as they try to dominate, polarize with the other parts, and you're off to the races. So
Yeah. So I think, if it feels okay, Dick, I think we probably have some questions. Do you feel okay to shift to that?
sure.
Yeah. So Brittany, you want to come in?
Sure, yes. First, thank you. That was great. I always enjoy and appreciate hearing the way that you share about this model in general, and then of course specific to eating disorders. It is it is my heart, so I loved that. We have a few that have come through the chat. Both seem like really great and relevant questions. So I'll just start with the first one. Rebecca says, when you update a part about your age and share, I can handle more now, how can you respond next if the part responds with rejecting the idea and saying, but can you really? You haven't really showed me that. I don't believe you.
A lot of times those parts have a point. Like I did that with a part once, and it said, I know how old you are, but you're still an idiot. So, and it had a point because it points to other parts that still dominate you. And and so I had to say, okay, you're right. In this way, I am still an idiot. And I'm going to work with that part that makes you so you don't trust me, so I can earn your trust. And so that helped the part relax and give me the space to work with the one it was polarized with, that was still around.
Yeah, yeah, that's great. I think about the benefit of that when our parts know that something externally is still going on, right? And then we're able to acknowledge, yes, I'm aware. And if you let me do this, I'll have more access to make whatever decisions we need to make about that. It's such a valuable response.
Yeah, let me say one more thing, because I didn't get to this either in the talk, that there are four main goals of IFS. The first we've talked about, which is the liberation of these parts so that they can be in their naturally valuable transformed state. The second, though, and this is related to her question, which is for the parts to come to trust self as the leader. And you got to earn their trust, just like some new parent comes into a bunch of feral kids and has to earn the trust, particularly of the parts who had been running things. And that can take a while. And then the third goal is to help all the parts start to get to know and get along with each other. And so you have more harmony inside. And then the fourth goal, which I think Theresa alluded to, is becoming more self-led in the outside world, so that in your relationships, you're not leading from these protectors all the time. And in your relationship with food, you're not doing that. And as you do that, as you become more self-led in the outside world, you also get a clearer sense of your purpose here, and that isn't necessarily about food. It's about something else in your life that the world needs. So those are the four goals.
Thank you. Okay, another one is Margaret said, I would love to hear more about helping clients let go of legacy burdens. I often have clients who have a lot of fear of gaining weight that is grounded in both experiences they have and societal legacy burdens.
Yeah. So the good news about legacy burdens, particularly these cultural legacy burdens, and when I wrote the last book I wrote called No Bad Parts, I identified what I thought were the four most pernicious ones, but there's lots of them. It's many of them we're talking about today. But the four I identified, I've mentioned one, which is patriarchy. That certainly affects clients with legacy burdens, I mean, with eating disorders. And then racism and individualism, which also has a role, and then materialism, which also has a role, which is related to how to have value in this world. And so the good news about cultural legacy burdens is because their existence doesn't involve something traumatic that happened to you in your lifetime. You don't have to often do all the steps that you'd have to do otherwise when we heal exiles with personal burdens that did happen to them in their past. And so, if you got an affirmative answer to that last question I asked, do you carry somebody else's energy? Then you can say to the part, do you like having to carry that, or would you like to unload it? Now, there's sometimes resistance to unloading it. I've done this with Holocaust legacy burdens, where people will say, it's my duty. My people suffered, I have to suffer. I would be betraying them if I let go. With these legacy burdens we're talking about, anti-fat bias and so on, some parts will fear if you don't carry that, you'll get really fat and get rejected. And so that you have to negotiate all of that. But once the good news, I'm sure I keep telling you there's good news, and I'm telling you all the problems, but once the part decides it doesn't want to carry it anymore, then they can just ship it out, and we'll give it up to the elements, light, water, fire, wind, earth, something like that, in a shamanic way. And after it clears, the part will transform. And because these are so widespread in our culture, and it's usually not just one that carries it. There's usually a lot of different parts that carry versions of that legacy burden, that anti-fat one, or that appearances consciousness one, or so you can invite them all to come and do it together, but a lot of times you have to kind of root out the others and help them too. But yeah, the legacy burden work is really important, because you can do all the healing work I described with personal burdens, but as long as these protectors carry these legacy burdens, the person won't fully transform.
Thank you for that. Um, Another one is Catherine's asking, what are the signs that a firefighter is turning into a manager after being around for so long?
Yeah. So you'll have firefighters that initially are these reactive impulsive parts that are like a part-time fire department and volunteer fire department, in the sense that, you know, they don't go into action until they're needed. But at some point, they decide, or the system decides, that they're needed all the time. And so then they shift from being classified as a firefighter in the sense that they're not reactive. Firefighters are reactive rather than proactive. So then their role shifts from reactivity to trying to preempt things that might trigger the exiles. And in doing that, they become more chronic or more around a lot. So that's the main distinction between managers and firefighters. Managers are trying to preempt anything that's going to trigger exiles and trying to contain the exiles all the time. And firefighters react after the fact, after the exiles burst out in these extreme ways. But sometimes those activities then become the most effective for the system's way to contain the exiles and preempt their triggering.
Someone's asking, when speaking with the parts, do you have any suggestions for people that struggle to let the answers come to them rather than thinking of the answer?
Yeah, that's a big problem, especially in the beginning, because most clients have been in other therapies and their thinking parts were called upon all the time to come up with the solutions or come up with the answers to the therapist's questions. And so they're used to being the ones to give the answers. And then, you know, in some clients, they're just chronically in charge and they have a hard time letting the client be in their body. They're just keeping them in their head all the time. And so they become the target part initially, if that's the case. And, you know, I would have you, Brittany, focus on that thinking part and ask what it's afraid would happen if it lets you hear from other parts and negotiate with it and reassure it that a lot of times they're afraid if you actually feel your body, you're going to be overwhelmed by all these exiles. So you know, I can reassure it about that. But yeah, if you're constantly getting the answers from the thinking part, then you got to deal with that.
I'm going to move to this one because I had a part wanting to ask you this question for the sake of how I think it relates to the one you just answered about firefighters becoming managers and how they move in and out of their roles. But that same person asked a follow up asking if you can give an example of a part that's in a firefighter type role transitioning to that managerial role.
Yeah, let's take somebody who, when an exile gets triggered, they dissociate and they're just, or I've even had clients who totally fell asleep and they're just gone. And then the coast's clear and then the person comes back and they're not dissociated. And they can function and they until the next time they get triggered and they dissociate again. And then at some point, they're getting triggered so much that the dissociative part just kind of moves in and keeps them a little bit out of their body constantly and makes them very spacey all the time or numbs the body. And so now it's become a manager, whereas before it was just a firefighter.
I think, Dick, I have another example. I think that might fit where if somebody is purging as part of their eating disorder, initially it might be more of a firefighter behavior. It might be a response to binging and just extreme fear and purging. But I'm thinking of a specific client that by the time she got to college, there was her purging had gotten to a place where it was more of coping and where it would allow her to focus. So the purging became kind of like a manager to help her get through her day to day, and it wasn't really an extreme firefighter. Would that, did I describe that in the right way?
Totally, absolutely, yeah, that's a good example.
Okay, another question is, can you share how you honor a part's fears and desires when they contradict treatment goals? For example, eating more, different treatment goals like that.
Yeah, so you want to role play, either of you guys?
I'm willing to try.
All right, great. Thanks, Brittany. So, yeah, Brittany, so let's get to know that part that's so set on binging still. So, you up for that?
Mhm.
So find it in your body, around your body. Where do you find it?
Kind of in my abdomen region.
Okay. How do you feel toward it?
Disgust.
Which makes sense, but we're going to ask the one who's so disgusted to give us the space to just get to know it for a few minutes. So see if that part could relax back just for a few minutes. So how do you feel toward it now?
I feel open, interested.
Yeah, so let it know that and just ask why it's so set on continuing to make you eat like that. And don't think of the answer, just wait and see what comes.
Mhm. I'm getting, it's saying something about comfort.
Uh-huh. So it's trying to bring comfort to other parts of you, something like that. Just ask if that's true.
Mhm. Yeah, I'd say I'm helping and comforting, making things feel okay,
You're helping comforting. What did you say?
and helping things feel okay.
Things feel okay. Yeah. Okay. Yeah. And the follow-up question, what's it afraid would happen if it didn't bring that comfort and make things feel okay?
That comes pretty quick. It's saying it'll be a lot.
A lot of emotion. What's a lot mean?
Mm-hmm. Overwhelming emotion.
Okay.
Mhm.
Yeah. So it's really trying to keep you from being overwhelmed by these parts by bringing them comfort all the time. Is that right? And how do you feel toward it as you learn that?
Understanding.
So let it know that you can appreciate that it's trying to help and this is the way it knows to help. And, you know, that I'm sure there have been times where you were overwhelmed in the past. And so it decided it wasn't going to let that happen anymore.
Mhm.
So
Yeah.
let's just stay with appreciating it for a while.
Mhm.
See how it reacts.
can tell it's feeling seen, and there's almost a warmth, a visceral warmth
Mhm.
there.
Good. Yeah, and ask it if you could go to the parts that it keeps trying to comfort so they won't overwhelm. You could heal those parts so they didn't need that kind of comfort all the time. And you were freed up from having to get her to eat all the time. What might you like to do instead? Or what might this part like to do instead inside of you? Just ask it that.
The first thing that comes up is have fun.
Yeah, it wants to help you have fun. How's that sound? So we're not going to do it today, but ask it how it would feel about letting you go to some of those parts if it could be reassured that we could keep you from being overwhelmed by them so that you could heal them.
Yeah, I'm getting this sense that it's saying like, yeah, if that can really happen, yes, I would like.
Yeah, it's skeptical. It makes sense, but uh, we would have to prove it to it. So that makes sense. So anyway, thank this part for letting us do this. And see if there's anything else it wants you to know before you come back.
No, the last thing it said was just thank you for asking me.
Yeah. And these parts are so used to being vilified that just even getting a little attention is very meaningful to them. So I do thank you, Brittany. That was a risky thing to do. Because I could tell it wasn't just a role play.
Mm-hmm.
So, but to answer that person's question, the setting of managerial goals just antagonizes these parts. And if you succeed in meeting those goals, it's because some other manager took over and locked this one up. But if instead we listen to it and honor it and heal what it reacts to, then you don't have to be managerial as a therapist. You can actually just be in self. So, yeah.
Another one is, what if your part has no idea what it would do if it didn't have to do the extreme role anymore?
That's not uncommon. And sometimes they just say, I just want to rest. I just want to lay in bed and eat chocolate and, just lay on the beach with a drink with a flower in it. So, we set that up for them. And then they ponder what they'd like to do if they were liberated. But they deserve a rest. So, yeah.
Okay, thank you. So far those are all the, oh, wait, we just got another. Okay. Um, Margaret says, how do you work with the reality that the fears of parts may be true? For example, if a client is in a larger body, there may be real consequences they face from others for not losing weight.
Yeah. We get that a lot with people in larger bodies. We get that a lot with people of color. A variety of people who live in our culture who, just because of who they are, they're getting hurt all the time. And so their protectors will protest when you ask them to relax because they're in real jeopardy when they walk out of your office. And so everything's negotiable. So what I offer is the possibility of them not having to totally retire as protectors. But if they allow us to go to the exiles that have been hurt so much from all the insults through all the years and are stuck in these places in the past, that if we can heal all of that, then what happens now in the present doesn't hurt quite as much. And they can keep their protectors around or on guard, but maybe the protectors don't have to dominate as much either. And they can allow for more self-leadership. So, but you know, it's really important to acknowledge the reality that they are getting these messages all the time from our culture, and it's not fair. And you know, I think one of the things that books like Jean's, my wife's book on unburdened eating, and there are lots of fat-friendly groups now, and you know, to have a network of people who kind of get it and can support each other, I think is also really important to counter the cultural messages that are inevitable. And that's, you know, a lot of that is from that legacy burden of willpower that uh, that just permeates our culture and is really influencing our politics these days. Like, you know, if you can't make it, it's just because you lack willpower. And yeah, that's a really pernicious one too.
I think one of the other areas where I find clients have a hard time unblending or kind of buying into the idea of healing, letting the protector healing the anorexia or the bulimia are clients that were in larger bodies as children and or naturally on their growth chart in larger bodies and lost weight from the eating disorder behavior, but when they were in larger bodies, told that they needed to lose weight by doctors or parents or put on diets when their natural body is larger than the 15th percentile, and or bullied and or all of the things that the child or adolescent took on, then when the eating disorder kicks in, and then all of a sudden, if it's more of an anorexic response to it, it goes from like all these people their whole life telling them, don't eat, be careful, don't eat, lose weight, to know like, oh my gosh, you have to eat now, you have to gain weight. And just creates this and literal polarization where it makes it so difficult to recover into the question that Brittany brought up. It's like, this was not the life. I was told this was the wrong way to be in the world. And I took on all of these really painful beliefs and emotions and experiences from back then. So how is this going to be okay? And reminds me of that part of IFS of being like the hope merchant and
Yeah,
really holding hope that it can be better.
yeah, yeah. I mean, people in that dilemma have so many hopeless parts, partly because they've tried so many things and they've tried to change their bodies so many times, and so they're just discouraged that their lives can change because they've been banking on their lives changing if they could lose weight. And so, yeah, shifting that whole set of goals is really challenging too. And I was going to say something about our view of recovery too, because I know the eating disorder world sort of takes on the view of recovery that the addictions world has, which is recovery means you're not symptomatic, and and you can count the days, and if you binge during that time or you eat the wrong thing during that time, then you're no longer in recovery, which just fortifies your managers to have that white knuckle recovery all the time. And for us, yeah, I mean, we have goals, but if you've done this work long enough, you know that there'll be times when people are going to still get triggered, and then their protectors are going to do what they've been doing. And so if then that is seen as a big failure and they're got to start over, that just compounds all the shaming and the fear of the binging parts or whatever it is. And so when somebody comes in shamefully saying to me, I went off the wagon, whatever whether it's binging on food or something else, I'm not despairing. I'm just saying, okay, that just means there's something in there we haven't gotten to. And so it's going to, if we follow this path, it's of the binge, it's going to take us to some exile we haven't healed yet, maybe. And so in a sense, it's a good thing because we're catching parts that we hadn't gotten to before. So it's just a very different philosophy that way too.
Yeah, I appreciate you saying that. We have people call all the time asking, well, what are y'all's beliefs about us really being able to heal from an eating disorder? And it's so powerful and life-changing to be able to explain it that way and then see it happen, right? It's much different. Okay, we have another question. It's 3 questions in one, all good questions. So I'll ask them one at a time. I think that might be easiest. The first one is, how would you explain or pitch IFS to a client who's unfamiliar with the model?
Yeah, so clients come in, they describe their problem to you, and we all learn to feed back what they're saying. It's reflexive reflective listening. And I'll just add, as I'm hearing different parts in their description, I'll just add the word part when I'm feeding it back. So I'll say, oh, so one part feels hurt, and then another part takes over and makes you binge. Is that right? Yeah, that's right. And then this other part then criticizes you after the fact. Is that right? And people don't say, what do you mean parts? Because everybody's used that language. That's why I use the word. It's the most user-friendly word. So they'll say, yeah, that sounds right. And, I can go on and maybe name when I'm hearing 5 different parts. And at some point I'll say, we've been talking about these different parts of you. And if you're interested, there's a way you can go help those parts change. And I'm good at it. And it does involve a kind of inner focus, and there'll be some emotion, but it also is very effective. And so what do you think? So some version of that often. And I won't make that pitch until I think the client would be receptive to it. So there are some clients you just get a sense that they're so closed up when they come in, and I would say more anorexics than bulimics, but that you just want to schmooze and make them feel safe with you before you entertain the idea of focusing inside. And so I'll bide my time in those situations before I do something like I just described.
Okay. And the second part of this question is, what are some apprehensions clients have about starting IFS? Well, I'll ask the other one. I think you might answer it all in one. And then, is IFS right for everyone?
What's the first one was apprehension they have about starting IFS?
Mm-hmm.
Yeah, a lot of clients, and for good reason, in other times when they've opened those doors to the exiles, or they've had them ripped open by events in their lives, things didn't go well. They got overwhelmed, they couldn't function, they couldn't get out of bed for days, or they got overwhelmed and their family attacked them for that, or, there's just some reasonable fears of these exiled parts. And so we work with the parts first. I learned that the hard way back in the day, that we don't go to exiles without permission from the protectors that are so afraid to open that door. And we go over and over all their fears until we get permission. And sometimes we don't get permission, and that's their choice, But a lot of the skill in doing the work is becoming a really effective hope merchant and coming up with the right ways to address these fears with a lot of confidence, and earning the trust of these protectors. So, but yeah, there's, some of the fears are also, I don't know what's in there. Maybe I don't want to know what's in there, things like that too. So, they have a right to not go in.
I often find not often, but sometimes clients will have parts that they come in and they want to go to the exiles way too fast. So they have a part
Right.
that's like, we have to hurry up and heal. And I find that I have to be a really good parts detector, because it
Right.
feels like self. It feels like this is the right
Right.
thing, but it really is overriding the protectors.
Yeah, no, I'm glad you brought that up, Theresa, because client comes in and says, yeah, I've got this emotional pain and it drives me crazy and I really want to fix it. I'm ready. And I'll say, we might get to it but before we even try, I want to know about all the parts of you that don't want us to. And I want to hear from them first, or are afraid to let us do that. So yeah, that's right.
Okay, and the last part of that question was, is IFS appropriate for everyone?
You know, related to what we were just saying, not everyone is up for doing it, for mucking around in the inner world. In terms of diagnoses, there aren't many diagnoses that we don't work with. There are differences in how we do it with different diagnoses. I mean, for me, the DSM is a fairly accurate description of clusters of protectors. So, but that's all it is. It's not like in medicine a list of diseases. It's a list of common clusters of protectors. So we do work with most everything.
Dick, can you talk a little bit about when you would do direct access with a part, and what direct access is for people that aren't familiar with IFS?
Yeah, so far we've been talking about the process we call insight, where I worked with Brittany. I was talking to Brittany, and I was encouraging her to ask certain questions of the part, which she was doing, and then she was reporting the answers to me. So the part was relating to her, and I was also relating to her. So herself was the intermediary, and we preference that. We Is that the right word? We privilege that because we want Brittany's self to become the primary attachment figure to these raw parts in there, rather than me. But there are times where it really behooves us to talk directly to a part. So there might have been a time when we were working with that part you were talking to, where I would say, Brittany, is it okay if I talk to it directly for a minute? And there's 4 or 5 or 6 reasons why we shift, which I've written about in some of the books. And So I would say, okay, are you there? Yeah. Okay, and you do this inside of Brittany, is that right? Yeah, that's right. Okay, and she was asking you what you were afraid would happen if you didn't do that, and you weren't answering, which is one of the reasons I'll shift to direct access. Is there something you could tell me about why you were doing it? Or is there a reason you wouldn't answer her? Or, so I'm just getting curious and staying in self. And a lot of times the parts will tell me stuff they wouldn't tell the client. So, and then at the end, I'll say, thank you for letting me know all this. And can I talk to Brittany again? Okay. Brittany, are you there? Did you hear that conversation? How do you feel toward the part now? So, and then I hand the baton back to you, and you then take over being the attachment figure for the part.
Great, thank you.
Okay, we have a few more questions. Emily says, a somewhat broad question, but what are your thoughts on dietitians using IFS? I hear a lot about its application in therapy, which is great, but no, many dietitians feel cautious and nervous to use it.
It depends on what you mean by use it. I mean, I think, excuse me, if you just use it as the language, as a language for helping people understand what's happening inside of them, that can be very, very safe and also very empowering and help clients feel less pathologized or less damaged and much more helpful. I mean, hopeful. And so, yeah, people like dietitians don't necessarily have to go to exiles and do all the healing, but they can help people appreciate their protectors and collaborate with an IFS therapist who can then do the rest of it. So, yeah.
And I have a few thoughts about that. And working in a treatment center is similar to Haven of Hope, where um, the dietitians, as well as the psychiatrist, everyone was trained in IFS.
Yeah.
And so everybody is coming from this lens of self and parts, so that and even direct care staff. So when you're sitting at the table and somebody's like shoving peanut butter in their boot, you can be really curious about that versus, hey, I saw you shove peanut butter, here's your supplement. But to be really, really curious and not jump in and be judgmental. And so for that's kind of like on a higher level of care. And then being in private practice, working with other dietitians that really have an understanding of IFS. So it takes it away of just focusing on doing the food, not doing the food plan, and being really curious about what's driving those parts can be really powerful. And so Marcy Evans is presenting tomorrow, who's a dietitian. And then on the second day, one of the full day breakouts is with Diana Richards and Molly Kellogg, who are dietitians, and they're doing a 5-hour presentation too. So just as far as dietitians for that. Yeah.
It's great. Yes, say hi for me to them.
Yeah. I think they're on now. Yeah.
Thank you. Yes, I completely agree, Theresa. I've seen the way it looks at the different levels of care, and it works beautifully together. And when the team is informed, and then even a step further when they're both trained.
Yeah.
Okay, so I know we're 9 minutes till the hour. We have a few more questions. I figure I could ask one or two more. Does that feel okay to you
Fine.
guys?
Yeah.
Okay. The next one is Eliza's asking, would you take a different approach to introducing and engaging in IFS work with someone who is on the autism spectrum?
Yeah, it is different. There's a great book coming out on this topic, IFS and autism or the spectrum, by a woman named, oh my,
I'll find it. I know who you're talking about.
I just endorsed it, but it's late for me. Uh, did you find it, Theresa?
I am looking. I just heard her on a podcast. Um, Sarah Bergenfield.
Bergenfeld, yeah, Sarah Bergenfeld.
Yeah.
Yeah, I'm so happy because I learned a lot just from reading about it. She's autistic herself, and yeah, it's so clear and clearly different. You do have to do some different things. So
So when I listened to her podcast, when she was talking about when she did the level 1 training, when everybody was talking about self and how to access parts, she's like, this is not how I access this. This is not me. And so from that, though, she really created how, as an autistic person, she could work with her parts. And she offered a scenario of, um, like, she had an idea of what she wanted for breakfast, which was a certain kind of bread. And her husband lovingly said, hey, I'll go down to the market down the street and get you your sourdough bread. And he came back with the sourdough bread, but it was like made with cranberries or something. And for her, when she thinks of something, it's not in an obsessive, even eating disorder way that I was thinking about my eating disorder clients, but she had an idea in her mind that it was going to be sourdough bread with toast with butter. And when he came back with this other kind of sourdough bread, she in the past would have gotten really reactive and really angry with him. But after learning IFS, she was able to notice the part, excuse herself from her loving husband, and work with that part to be able to come back and say what I was expecting. And so it was so helpful for me. And I talked about that with 2 of my clients right after I heard it, because they are more on the spectrum and they're like, that's exactly right. So I'm really looking forward to her book coming out, but I didn't mean to hijack that conversation. But yeah, I think that she's really great.
yeah, not a bit. And a lot of the rigidity with the protectors comes from how bombarded autistic people's brains are with stimuli. So that was news to me too. It's just really useful.
Yeah,
Theresa, do you mind sharing her name again? Someone asked in the chat.
sure. It is Sarah Sarah with an H, SARAH, BERGENFIELD. Here, I'll put the oh, it's that actual podcast. I found it. I like when that happens. Okay, I'll put it in the chat.
Thank you. Okay, there's one more. Oh, I have parts that want to hear what you say about this as well. Do you have any tips on working with clients who struggle with visualization and struggle to connect with parts because of this?
Yes, I'm one of those people.
Same.
Turns out I have something called aphantasia, which about 5% of the population have. For years, I thought, how ironic, I developed this thing and I'm the only one who can't do it. But I just do it differently. We do it differently. We don't see parts. It's like we're doing all the work in the dark, like the lights are off. But we can sense them and we can hear them, their voices, and we just do it differently. And a lot more direct access. I respond very well to direct access. And yeah, like that. So if you're one of those people, don't despair. You know, we should have a support group for aphantasia people in IFS. So yeah.
Thank you. Okay. I think you answered this one earlier. I'll say it again, just to, you might have an additional way you'll answer it. But this person also said, or with clients who have difficulty getting out of their logical parts.
Yeah, I think when we were talking about the thinking parts, it's sort of the same. Yeah. Yeah.
Okay, I think, Pamela, as you have a raised hand, I want to make sure you didn't want to ask something live. I don't mean to call you out, but there is room. Okay.
She said she accidentally raised her hand. She's good.
Yes. Okay. I know that was earlier. Okay. Yeah, I think that was the same thing. Okay. You guys have answered all questions, right? Within just a few minutes.
Perfect.
Great.
So, Dick, I just want to take a second and just thank you again. And I have been, as I've been preparing for this conference, just thinking a lot. I do timelines, will be a shock to Marcella and to Jean. And when I think back to the timeline of the Tri-State Eating Disorder Conference unfolding, and that initially it was reaching out to Amy Pershing and Shavis to come do like a lunch and learn with me in Evansville, Indiana. And I was like, no, don't ask. And then nobody's gonna, but they both said yes. Everybody said yes. And that next summer I was sitting with you and Jean asked if I was gonna like do the conference again. And I asked you, and I'm like, but you would have to come and you would have to be in person in Evansville. And you said yes. And so, that really infused me with this strong, strong desire to continue to ask, and to accept that people might be willing to come to bring these worlds of IFS and eating disorder recovery together. And the model is just been so transformative, as you know, in my life, and therefore in my clients' lives. It's so far reaching. And so I am so grateful that you had this time to come, because it's very rare that we get you live in these types of situations. So just so much gratitude for you.
Well, I'll throw it back to you, Theresa, because it's thrilling to me that you have this project of bringing IFS to the eating disorder world. And like I said, I have a lot of fondness for eating disorder people and gratitude to them. And it's been great to watch you grow, Theresa, over the years. To think that you're heading up a big conference like this.
Yeah, it does scare me. Yeah. So thank you. Yeah. Yeah.
And yeah, just to stay connected and yeah, so and there's a whole bunch of people that are still around from Castlewood days that it's so great to stay connected to. So and
Well,
also
go ahead. I'm sorry.
also good to get to know you, Brittany, and I'm thrilled that there is the Haven of Hope. So I'll try to make that more well known.
Yeah, thank you. I told Teresa already, and I'll be brief, but if someone would have told me in 2016 when I was exploring your model that this is what would happen now, I wouldn't have been able to fathom it. So I'm truly, truly grateful personally and professionally. I've been a clinician longer than that, but at that stage in my career is when I really started deep diving into IFS, and then the formal training and all the great workshops. I joined one of your virtual last minute opening workshops during the pandemic and got to watch you live and was like, okay, yeah, I'm doing this. So it's been great. Thank you for letting me moderate this tonight. It's been really, really nice.
So we'll let you go, Dick. And Brittany, thank you so much for moderating, and Marcella for sitting in the background, ready to jump on if the storm came in. And for everybody who showed up and is still on, thank you for coming in. And I look forward to getting the conference going tomorrow. Take care, everyone.
Thank you.
All right.
Bye.